Hi, I'm Dr. Narda Robinson, President and CEO of Curacor Integrative Medicine and Education Center. I've been drawn to natural medicine since I was a child. I remember as a kid mixing plants and sticks and mud in the backyard, imagining myself making herbal remedies. I also loved animals and thought about becoming a veterinarian. When I entered college, I had many interests: psychology, neuroscience, music, and Eastern philosophy. As I looked toward a career, I knew that whatever direction I chose had to allow me to express my compassion, to seek truth, and to live with integrity. That remains true to this day. After I graduated from Harvard, I studied neuroscience for a year in graduate school, but then opted instead for osteopathic medicine. Instead of becoming an MD, I chose osteopathy because I resonated so strongly with its premise. During medical school, I became fascinated with neurosurgery, and for a year served as an assistant to a neurosurgeon in a medical school fellowship. It was during this time that I saw both the strengths and the limitations of invasive procedures. I saw how desperate and depressed people become when they are in pain, and how ill-equipped so many medical professionals are to not only diagnose, but also treat pain safely, effectively, and non-invasively. Fortunately, soon thereafter, I found a mentor at my osteopathic school that introduced me to acupuncture, herbal medicine, and then we practiced those alongside osteopathic manual medicine. He showed me how to use these methods to help people heal themselves, and also to serve in the role of both teacher and healer. However, I also needed to practice integrative medicine in a scientific, evidence-informed manner. It didn't suffice to take someone's word that this or that herb, supplement, or treatment technique was powerful. I needed to know what it did and how it worked, as well as to examine for myself claims of effectiveness and safety. When I completed my education, I opened a scientifically based integrative medicine practice in Boulder, Colorado. I enjoyed what I did, but I also wanted to work with animals. I volunteered at a wildlife rehab center where the staff veterinarian asked me to treat some of the animals with integrative medicine. I did, and found the results astounding. Not only did many of the wild birds and mammals recover quickly, but I also felt a rush of joy treating those animals that I'd never experienced in human medicine. It was then that I knew I had to become a veterinarian. I applied and was accepted into the Colorado State University College of Veterinary Medicine and Biomedical Sciences. In my third year, though, I saw the same problem in veterinary medicine that was all too common in many human hospitals and doctors' offices. Have a problem? Here's a drug. Or let's schedule surgery. There gets to be a tunnel vision, both diagnostically and therapeutically, that runs counter to everything I stand for. So I sought to change the system. I proposed that CSU begin an acupuncture service. The administrators I petitioned agreed to do so, in part because they were patients in my human practice and had personally experienced the benefits. For the next 20 years, I continued that service until there were others who could take over at CSU so that I could pursue my mission through Curacor. At Curacor, we seek to put the soul back into medicine. When we reintroduce humanity, empathy, and a hands-on physical examination, we become better diagnosticians and caregivers. In so doing, we can improve outcomes, reduce costs, and restore joy to the profession of caring for others. We give patients options and base those options on sound science and research evidence. Because at Curacor, we believe that all patients, no matter the species, deserve safe and effective medical care. Together, we can change medicine.